Madam President, to close for our side, I'd like to strongly urge my colleagues in a few minutes to support the nomination of Sylvia Matthews Burwell to be the next Secretary of the Department of Health and Human Services. And I want to start with a simple fact. Sylvia Matthews Burwell's nomination has a breadth of bipartisan support because she's really that good. She's really that capable, and she's really that qualified. And I'm going to say to colleagues, nobody's got to take my word for it. We all know that our colleague from the other side of the aisle, Senator Coburn, is a man of strong views. He says what he means, and he means what he says. And as a ranking member of the Homeland Security and Government Reform Committee, Senator Coburn has had many opportunities to work closely with Ms. Burwell during her service as the OMB director. Here's what he said. For example, he emphasized the nominee's competence. And I quote, "The fact is, when you have somebody that's competent and also has strong character, you find a way to get past your differences to try to solve problems." And he emphasized that she's a good listener and that she's communicative. Here I quote, "Responsiveness is a key for the Congress." And I have to tell you, I found her remarkably responsive. The fact is, she's going to be committed to do the right thing and to keep Congress involved. And finally, in a quote that I thought was particularly striking, Madam President, Senator Coburn said, even when she has made up her mind, which sometimes happens, she'll listen to another point of view to get information that she might not have. And Senator Coburn said, that's a characteristic too often that we don't see as members of Congress and in members of the administration, whether they're Republican or Democrat. And Senator Coburn is not the only one who is part of this, you could call it, choir of bipartisan support for Sylvia Matthews Burwell. When she went before the Help Committee, our colleague from North Carolina, Senator Burr, another Republican, said, and I quote, "I support her nomination. I will vote for her in the Finance Committee, and it's for one primary reason. It's because she doesn't come with a single experience that would make her a good secretary. She comes with a portfolio experience that would make her a tremendous asset at addressing some of the challenges that the agency specifically and uniquely has." And Senator Burr said, "I look forward to her confirmation being quick and our ability to then work together to be every bit as quick." Madam President, these are statements that reflect a nominee who is going to be, in my view, an active agent of bipartisanship. She's somebody who's already shown that she can bring Democrats and Republicans together to solve big challenges, and I think she's going to show it at the Department of Health and Human Services. And suffice it to say, we know that Health and Human Services will need strong leadership in the days ahead. And we know the debate about the Affordable Care Act is going to continue, Madam President. It's going to continue in Hawaii and Oregon and across the country. And my hope as chair of the Finance Committee is that Sylvia Matthews Burwell can help bring together Democrats and Republicans to build on the Affordable Care Act, just as many of us did to work with former President George W. Bush to strengthen the Part D program, the Medicare prescription drug program. Many of the first stories about Medicare Part D were much like the first stories about the Affordable Care Act. And yet Democrats and Republicans came together, were able to strengthen Part D to the point where now enormous support among seniors, and it's come in at 30%, more than 30% below the cost projected by the Congressional Budget Office. So let's all work together with Sylvia Matthews Burwell to do for the Affordable Care Act what we did with George W. Bush's program on prescription drugs, and that's work in a bipartisan way. And Madam President, one of the reasons I'm so enthused about Sylvia Matthews Burwell is that we have big challenges that both sides, both Democrats and Republicans, are going to have to team up on to tackle in the days ahead. For example, Medicare in 2014 is dramatically different than Medicare when it began in 1965. In 1965, for example, Madam President, if a senior broke their ankle, if he or she needed to see a doctor, they went perhaps outpatient program, Part B of the Medicare program. If they needed more attention, perhaps the ankle needed to be reset, they had to go to a hospital, they would get assistance in the hospital under Part A. Today, that's not primarily what Medicare is all about. Today, Madam President, well over 80% of Medicare is tackling chronic disease. We're talking about diabetes, we're talking about cancer, we're talking about strokes and heart disease. And certainly, if you add Alzheimer's on top of it, that's 90% of the Medicare program. That broken ankle, when the senior has one, of course it has to be taken care of. But most of Medicare is about chronic disease. And so what we're going to need is Democrats and Republicans coming together to tackle an issue that, frankly, has gotten short shrift in Washington, D.C. Didn't come up a whole lot in the debate about the Affordable Care Act on any side. And yet it's going to be the issue that dominates the future of the flagship health care program in this country, Medicare, and much of what is done for chronic disease for the Medicare population, Madam President, will also be copied for the under 65 population, since the trend historically, when Medicare takes bold action, it's often replicated in the private sector. So some of this work has begun, but the fact is we need a strong leader with bipartisan support, as I've tried to highlight with Dr. Coburn's comments and Senator Burr's comments and others. And Madam President, I think it was all summed up when Dr. Coburn and Senator Rockefeller, the senior Republican senator from her home state, teamed up that first day and set the mood about how this would be a nominee with exceptional ability to reach out and tackle the big challenges of our time. Medicare, of course, in my view, is the biggest, but the issue of family support, the child welfare programs that the department manages, these are programs, Madam President, that are critical lifelines for struggling Americans across the country. So many of our people are now falling between the cracks into poverty since the recession. And the Department of Health and Human Services plays a powerful role ensuring that we have a strong safety net. Now, I've talked about her credentials before, but her education, a stellar background, a graduate of Harvard and Oxford, where she was a Rhodes Scholar. She was a staff director of the National Economic Council, so this is someone with real savvy on the big economic challenges. And she's got superb experience in 1997 becoming Deputy Chief of Staff to the President and moving the following year to become the Deputy Director of the Office of Management and Budget. She also has extensive experience in the nonprofit world. At the Gates Foundation, she led efforts to tackle some of the most pressing global health challenges of our time. And at the Walmart Foundation, where she served in 2011, she offered outstanding leadership in the fight against hunger and to improve economic opportunity for women. Now, as senators consider this nomination here in the last couple of minutes before the vote. I only want to remind, perhaps not subtly, Madam President, the Senate confirmed Sylvia Matthews Burwell for the position of Director of Office of Management and Budget, 96-0. 96-0, Madam President and colleagues. I think that's a pretty rare statement of bipartisanship for an extremely important position that not only has Sylvia Matthews Burwell discharged very well, she has won additional plaudits for her bipartisan work, as I've indicated today. She is going to respond to the big questions and the big challenges in a way that I believe brings Americans together. That's what senators have said throughout the process, and they've said it whether you have a D or an R next to your name. What the country needs, in short, is somebody who is a true agent of bipartisanship. I conclude my remarks, Madam President, by saying I've gotten to know Sylvia Matthews Burwell well in the past few years. She is the right choice for the right time, and I strongly urge my colleagues on both sides of the aisle to join me this afternoon in supporting her nomination. With that, Madam President, I yield the floor.